Dear viewers, welcome in my another new video. Uterine fibroids is a very common problem for women. Fibroids are irregular growth and it develops in women's uterus. Sometimes these tumors become quite large and it causes severe abdominal pain and heavy period. Today in this video, I will discuss the causes, symptoms and treatment of this problem. If you are new to the channel, you can subscribe to the channel because it can be a great collection for you. Uterine fibroids are non-cancerous growth of the uterus. They frequently develop in childbearing years. These problems are not connected with the great risk of uterine cancer and they never develop into cancer. Most of the time, uterine fibroids don't make any symptom. About 80% women don't experience any symptom. Women can get a single tumor, or they also can get multiple tumors on their uterine area. The exact causes of uterine fibroids are unknown, but we can identify a few common causes of this problem, such as many fibroids contain changes in genes that differ from those in normal uterine muscle cells. Ovaries produce estrogen and progesterone hormones. These hormones causes the uterine lining to restart during its menstrual cycle, and it may stimulate the growth of fibroids. Fibroids may run in the family. If your mother, sister or grandmother has a history of this condition, you may also get this problem. Pregnancy increases the production of estrogen and progesterone in your body. Fibroids may develop and grow rapidly when a woman is pregnant. Symptoms of uterine fibroids depend on the number of tumors, their location and size. If tumor is very small or your age is about 45 years, you may not experience any symptom. Now, we can identify the most common symptoms of this problem, such as heavy bleeding during your periods, including blood clots, pain in the pelvis or lower back, increased menstrual cramping, increased urination, pain during intercourse, menstruation that lasts longer than usual, pressure in your lower abdomen, and swelling of the abdomen. Uterine fibroids usually don't interfere with getting pregnant, but submucosal fibroids may cause infertility or pregnancy loss. Fibroids may also raise the risk of certain pregnancy complications, such as placental problem, fetal growth restrictions, and preterm labor. Treatment of this problem include into 4 stages. In the first stage, women can apply home remedies. Acupuncture, yoga and massage are the main home remedies. In the second stage, you should take medications which your doctor prescribes. At final stage, you need a surgery. A perfect surgery can cure your problem finally. Dear viewers, if you have any other question about the uterine fibroids, you can comment in this video. And finally, please don't forget to subscribe to the channel to get our next videos. Thank you.